Okay, so I went to the dentist the other day. And it's really strange how things work. So here's the deal. The other day my son made some rice. I was eating this rice and sure enough, I cracked my tooth. I don't know what was in the rice, but I felt like I was crunching on glass or a rock. You know how when you feel like you stumble upon something in your mouth as you're eating and maybe you can chew it away or just like chew and swallow, hurry up. It was one of those kind of moments, but when I was chewing on this thing, which actually turned out to be my tooth, it was like chewing on a rock. I cracked my tooth and hence I had to go to the doctor, the dentist, because now I was in pain. I was like, oh, I must have lost a cavity, must have fell out, blah, blah, blah. Sure enough, I went to the dentist and they looked and they couldn't find the place where they thought the cavity might have fallen out. It wasn't obvious. It wasn't right there in front of them. So you got another doctor in his office with a second pair of eyes, as he said. And the other doctor came in and he looked, the dentist, and he checked and he said, okay, is it sensitive to hot and cold? I was like, not really, but it hurts, And he looked and he looked, and sure enough, he did discover that my tooth was cracked. One tooth back there, a fourth from the front, perhaps. And that's what I'm assuming. And he said, oh, I see it. It's a crack. And it not only did it split halfway, it didn't split, not only, it didn't split halfway because it split vertically. Therefore, now I have to, he said, what I'd have to do is get an implant, a dental implant. Now, I already have one, and that one is right here, my front tooth. So I have a dental implant already, and it costs like $3,000 for this implant. So I'm like, are you kidding me? He said, oh, you can get a bridge. Now, you can look up the difference between a dental implant or a bridge. I don't really, maybe I can go into that and tell you the difference, but I don't, that's just like another video. But nevertheless, so I decided to go with the implant. So we took x-rays, blah, blah, blah. And, so now on my way to, what was the next thing? Wait a minute, as I'm thinking about this. Okay. I was having a pain in my neck prior to that, now as I'm thinking, because I wanted to say that the pain that I was experiencing in my neck had to do with the dentist and the x-rays, because you're supposed to, if you don't know, whenever you go to a dentist and they're going to do x-rays, you need to get something that covers, ask them, because they're not going to tell you, but you need to cover your neck to protect your thyroids and everything else in this area, whatever else is there. And I didn't know, so I was thinking that it had to do with the x-rays, that pain that I had. But now as I'm talking to you guys, I'm so glad that I am. It really wasn't, I had both pain happening simultaneously. And I remember telling the doctor, no, I'm having a pain here, I'm having a pain here, I'm going to take care of this first, and then we'll go take care of this. Okay. So now that I remember, so I didn't ask for that thing that covers and protects your throat when they do x-rays, but I'm letting you guys know that you should, especially for women, because thyroid is a very popular thing amongst women. It occurs in women more often than men. And I went to the doctor, so I took care of the dentist. So he told me what I have to do. I have to do this implant. Very good. I'm ready. Let's order the implant, or let's set up the date for the extraction of the tooth. All right, now I just saw the dentist. He told me what I have to do. Now I'm ready to go go to the doctor because my neck is in pain. I'm having pain in my neck. I go to the doctor. I went to see my doctor first. That's right, and I made an appointment. with my doctor. So I was having this pain before. Okay, so I wasn't going to tell you that it happened because of the x-rays when I had the pain, but actually the pain occurred before that. So, okay. All right, everyone. I don't know what the story is. When you feel like you have a lump or something, you automatically, for you guys, I don't know about you, but I just like assume the worst. And what am I going to tell you? So I was experiencing this pain in my neck. So I'm going to take off my shirt so you guys, not really. Okay, forget that. There's this lump. I don't know if you can see it. This is interesting. Maybe that's it right there. It's right, that's a lump though. On this side, there's nothing, right? I don't see it. But this side, it is right there. Okay, so I went to the doctor, to see my doctor, and he checked me out, and I'm sorry. So he looked at me and he said right away, he did an unofficial, sonogram. His technician was there, so he said, this is going to be unofficial, but let me just try to kind of look and see what we're dealing with, and then I'll let you know. So he did an unofficial sonogram, and his technician explained to him what she saw, and he said, I want you to go to the hospital right now. My doctor, his colleague works there at Beth Israel, and he wanted me to see him, and blah, blah, blah. So I went to the emergency room. That was about 11 o'clock in the morning. They ended up keeping me overnight because they still was running the tests and didn't know exactly what it was yet and how, that whole thing. So actually it felt like a vacation, just that one day just to rest. I was so mentally exhausted, and of course exhausted because I'm always going. And I was a little sad because I was in pain, and I'm not usually in pain. And I cried, I cried quietly, secretly. And then, because, that was like so unusual for me to experience things like that. So, nevertheless, they kept me overnight. So that morning, they wanted to run another test, and this test was a sonogram, their sonogram, to see what the lump was, because they also did a thyroid test, and the blood results came back that it was negative, that there was no thyroid traces in the blood, or something that whatever that blood test does, and you can look it up. I forgot the name of it, but it detects if there's thyroids, if it's a thyroid situation. And they didn't detect that. However, as I was reading up on it, sometimes you can't really rely on the doctors to really tell you for sure what's going on. And I would have to say this is not my first experience having lumps and bumps and being, going from doctor to doctor, or just being unsure what's happening, what's going on. You really got to stay on top of your own health. You have to be the advocate of your own body, and that's pretty much how it goes. So, what was I saying? We did a sonogram, and then they discharged me. They discharged me from the hospital without the final word in terms of what they discovered or what the situation was. They said the doctor left. They didn't give me, they should have allowed me to take home my results from all the tests. But the following day, now I had to do the running around back and forth to try to get the test to my doctor so he could read it and tell me what he saw, what was the final say in terms of the sonogram. And I did that, and sure enough, he said that there was nothing, they did not see. Honestly, I really don't, even though he said he did not see what, it wasn't like, I don't know, it was negative. Whatever negative mean, I don't know to this point. So I'm really nervous. I do know that I have a lump in my neck, and it, even though they said thyroid, they ruled that out for now. I don't know. So I'm really nervous. 10 years ago, I had a lump in my colon and a lump in my breast and in my left breast. And that same week, I had both lumps removed. My colon was a carcinoid tumor, and I had a benign lump in my breast. So that was like the most, I can't even describe what that felt like, but I just saw the end for me. And 10 years later, now there's a lump in my neck. So I'm a little nervous, and I was crying earlier today, and I was very sad, but also like concerned, and a lot of different emotions, because I don't know, a lot of emotions about this, because it's the weekend and the doctor's office is closed, and I'm going to be taken off so I can go and find out what's going on, and I'll let you guys know. So I just wanted to tell you guys I needed someone to talk to and someone to cry to. I already cried already, so I'm not going to cry. When I get ready to cry, maybe let you guys cry with me if you have a problem. If you're going through some things as well and you want to cry, we can cry together. But I just wanted to say that, and I'm scared of that big C word, cancer. It's like, where is the cure? And I don't know, cancer or not. We shall see. All right, guys, gotta go. Love you all. Bye-bye.